my diabetes and blood pressure medication is going to stop. They're not going to stop. You can control them, but these are not like infections. You can't just take them for a few days and stop. This is called chronic disease management. You need to continue taking these medications unless your doctor tells you so.
In your dual role as a General Physician and Gastroenterologist, what are the most common OTC-related emergencies you've managed?
So the most common in my role is liver problems. A lot of people come in with deranged liver function tests. They sometimes, in severe cases, they become jaundiced as well, which is basically meaning yellow color changes in your skin and your eyes. And when you dig deep, you find out that they've been taking a non-steroidal or over-the-counter medication, or even sometimes herbal medications for a very long time. And one problem over-the-counter medications also gives is you start picking up medications from your colleagues or friends who said, this is the medication, this is the pill I took and I got better, and this is what you start doing without realizing what's in it. So liver problems is very common that I see in my dual roles.
Is public awareness about OTC risks improving, or are patients still underestimating these drugs?
I think in general, my view is very skeptical about education about medical problems. The awareness, I would like to think they are improving, but unfortunately it's not, because our use of medications and self-reliance on self-medicating has increased. I think it's just not only that they don't trust the doctor, they don't want to go to doctors, it's economic as well, financial as well. Plus, I think the media also plays a role, because you start seeing lots of advertisements thrown at you that your this medication will help this condition, and the people start taking these things in their own hands. I think a lot of people are doing a good job. I think our schools are playing roles as well. This is where young children are coming forward and saying they don't want any medications. So this is a good thing. There is certainly room for improvement, but I am hopeful we are heading the right way if we start incorporating this in education.
How do you identify patients at high risk for OTC drug complications during routine checkups?
So in routine checkups, what I generally do in my dual role, and when I put my general physician hat on, is that I go through their medication, what they are already taking. And I think it just needs a little bit of time. That is the single most reversible risk factor that we can do in reducing the risks. The other one is routine checkups. Routine checkups I advise after a certain age, and especially people who are having other medical problems like heart disease, diabetes, strokes, or some chronic disease or ailments, is do routine checks like check their liver function test, check their kidneys, check their full blood counts. So this would be an early indicator into if they are having or they are prone to have problems with over-the-counter medications.
What simple strategies do you recommend for patients to avoid accidental overdoses, for example, tracking multi-ingredient medications?
What I would like to take this opportunity is, and I keep telling my patients as well, whatever medications that you're taking, everybody has a smartphone. Get your phone out, put your medications together, take a picture. There is one medication that comes with 100 names. And I assure you, with all my hundreds of degrees and working in different countries, I cannot remember all of the trade names. So the most important thing is to remember or keep a note of the compound name, which you can't do. So the best thing is take a picture of it. The other things that we can do to reduce accidental overdoses, especially with elderly people, is pill cams or dosage boxes. So basically what this is you tell your pharmacist they can arrange all of this, or you can do it at your own home with somebody who's good at eyesight or who's a bit younger and a bit know-how. They can place these medications in a timely cassettes. So when you've got an elderly member of the team or in your family, what they do is they just go on, open that box, take the time medication, and this would improve their compliance and reduce the chances of accidental overdoses.
How does your expertise in gastroenterology inform your approach to managing OTC drug misuse in general practice?
Look, the idea is the more you know, the more you can do. So, because when I qualified, I became a general physician first, and then you have to take a specialty. And this is what normally happens in Western countries as well. So, what this gave me an opportunity is, one, to have a general knowledge of commonly used medications, and then start having a more specific interest in my specialty related medications. So this is me going one step up. Your general physician is very good, because general physician has a more broader spectrum about what the medication that you're taking and the impacts and the interactions. Because the specialists, sometimes what they do is, in my field, I'm more tunnel visioned on what medication will help me, and sometimes they will avoid or ignore the effects what they will have. So this is what my being dual role helped me, that I would not only concentrate on my specialty medications, be it for the liver or the gut, but also relate it to the other medications like diabetes, like blood pressure, like heart problems, and bring them all together and formulate a plan.
Can you share a case where an OTC medication masked a serious underlying condition?
I'm sure my colleagues and everybody has lots of examples. One of very recent example was patient started having problems, patient felt weak, general lethargy, common day problems. And what they started doing was started taking some supplements. And they started having some problems, some weight loss, started taking supplements for that. And by the time he came to me, and we started going through his history and found out that there were some red flag signs that were being masked by these supplements. And then when we investigated, and he had an underlying cancer, and that obviously had progressed a bit. So had we caught it early, it would have been early detection, early treatment. Now it took a lot longer, spent a lot of money and effort as well on their part, and obviously because the disease has advanced, the treatment options were limited.
Should pharmacists play a larger role in screening patients for OTC drug risks?
I think pharmacists should be our first line of defense, because lots of pharmacists, lots of these medical stores that are working, there are lots of people who know what they're doing. If you see a patient who are coming with multiple prescriptions, then you're the best one. The pharmacist is the best person to know what the trade name and what the chemical formula in it is. I think they are the first line of our defense against mixing medication, against polypharmacy, and avoiding accidental taking same medication more than one time.
What policy changes would you advocate for to improve OTC drug safety?
I think the first thing that we should do as a community and as a country is reduce the number of medication and the type of medication that people can take over the counter. I think and I cannot stress more, is antibiotics. Let's just stop this antibiotic epidemic. Let's limit sleeping tablets. Let's limit painkiller medications, strong painkiller medications that we are dispensing patients without prescriptions. Once we limit these, this is the first step that we will take on educating them, because what the patient will now get a message is that they need to start taking these medications more seriously. This is the one thing that we can do in changing our policy.
What one rule should every patient follow when using OTC medications?
One rule, and I keep telling my patients, you have a smartphone, take a picture of all the medications. You don't need to go through your prescriptions. Take pictures of your medications that you're taking, number one. Number two, when you're taking any over-the-counter medication that you need to take more than 3 times a week, this is where you start, this red light should start in your head, that this is now the time I should start taking serious help. I should start talking to a pharmacist, I should start talking to a clinician or a physician. This is where the problems might start early. Now, rather than hooking on to medication, try hook on to general healthy stuff. Exercise, walk, good health, reduce processed food, reduced oil, and get rid of your habit of doing a patch-up work. No, there's no one pill for everything. If you're having to take regular pills, this is where you should start taking help.